Good evening, everyone. Thank you for joining us here at KREM 2 News at 6. I am Joshua Robinson. Mark and Whitney are enjoying tonight off, a day after the Washington State Department of Health announced that it hired Dr. Bob Lutz to work on its COVID response team. We are hearing from Lutz tonight. Now, while he declined to discuss his firing from Spokane Regional Health as the health officer, he did want to reach out to thank the community for all of their support this past month. And as KREM 2's Mark Hanrahan reports, he also talked about why he decided to stay in the fight against COVID-19.
So for me, this is a job half finished. This is a book half read. And so I really want to be involved. This is my community. And I really want to ensure as much as I can as one person, the safety and well-being of every community member. To be able to do that also at the state level so that I can really have impact across the entire state. That's why I do it.
What has the last month been like for you?
Yeah, Mark, definitely it's interesting would be probably the best adjective to use. It's just, a lot of ups and downs. It just, there have been some highs and some lows. Certainly, as I mentioned earlier, Mark, the amount of support that Amy and I have received has just really helped us immeasurably during the last few weeks.
What do you think about the current situation with COVID-19 in Washington and in particular in Eastern Washington?
It's disturbing. It's concerning. Certainly in Spokane, as you know, if you look at the curve, you've never really seen a decrease of significance. Gosh, we had a little bit of a downturn during the summer, but for the most part, we've just been on this sort of gradual rise. And then, after September, it just sort of exponentially blew up, and we continue to see a real significant increase. Spokane, but also Eastern Washington.
But do you feel like Spokane Regional Health at the moment is handling the situation good or poorly, or could they do better? What are your thoughts on that?
No, I think, irrespective of me not being there, Mark, the professionals at SRHD, they always will be doing their best work to ensure the safety and the health of the entire community. So irrespective of my absence, they're doing everything they can, but it's not just the agency, it's not just the public health professionals, it's everyone collectively that needs to be really working, because, what they're doing is providing the guidance, providing the epidemiological investigations and recommendations, but it really comes down to what people are doing.
And again, Dr. Lutz declined to discuss his departure from Spokane Regional Health District. In terms of his new role, he says he'll be focused squarely on the state's response to the pandemic. He says he'll be working remotely and that he and his wife are staying in Spokane. Today, the Spokane Regional Health District is reporting 345 new COVID-19 cases. There are 2 new deaths, bringing the total number of deaths up to 299. 62% of people who have had COVID throughout Spokane County have recovered. 121 Spokane County residents are currently hospitalized. Looking now in North Idaho, the Panhandle Health District is reporting 219 new coronavirus cases. 2 new deaths were also reported, and currently 73 North Idaho residents are in the hospital. There have been over 12,000 coronavirus cases since the pandemic began. And Idaho is set to receive at least 13,000 doses of coronavirus vaccines. The Panhandle Health District said today that 1,950 doses of the vaccine will be available in North Idaho. The first shipment of the vaccine is expected to arrive next week. The Idaho COVID-19 Vaccine Advisory Committee does recommend frontline healthcare workers caring for COVID patients and long-term care facility residents be the first to receive the vaccine. Those in direct contact with COVID-19 patients will be high priority for the vaccine, and the state expects to receive another 89,000 total vaccines in the second and third shipments. We do want to get to weather next. We will continue to see snow falling around in the northwest like what we saw earlier today. Let's bring in Thomas Patrick to break down what else we can expect tonight and into the weekend. Thomas?
Yeah, snow is going to remain a priority of our forecast through the extended outlook here. And today was our first December snowfall You have to go back to the last day of November, the last time that it snowed in the Spokane area. Well, a couple snow bands a little bit persistent into the evening hours. Still anticipating it's going to fizzle out in a couple hours time, but hanging on just a little bit longer, and you might be able to see a few of the snowflakes falling just in our studio lights here from our outdoor weather center here. So yeah, a little bit of some light snow still falling, especially between Tico up towards the South Hill. I think is getting hit a bit harder than say the downtown Spokane area at the moment. Temperatures have just dipped below the 32-degree mark, so some of the leftover water is trying to freeze over. So just be cautious for that tonight. We're getting our first snowfall totals into the weather center as of this hour. Looks like Colfax got the most at 3 inches of snow. Most areas getting about 2 inches, give or take maybe a couple tenths on either side, depending on where you might live. As mentioned, our temperature is now dropping below the 32-degree mark. It's 31 right now in Spokane, 30 in Deer Park. So some of that leftover or melted snow from earlier today on the roadways might actually start to freeze over into some ice. So just be a little bit cautious on the roads tonight. And then our next round of snow looks like it's hitting us for this Sunday, what's going to be a very active week weather-wise come all of next week. More on the extended outlook in just a few minutes.
We'll see you back here shortly, Thomas. Also new tonight, a wedding in Adams County is now linked to at least one death in a Grant County long-term care facility. Health officials say staff at local care facilities were part of the 300 guests at that wedding. Our own Ian Smay is in the newsroom tonight to break down what we know so far. Ian?
That's right, Joshua. That wedding in Adams County made national headlines after being deemed a super spreader event. That's because the wedding has been linked with coronavirus outbreaks at long-term care facilities in Grant County.
It's our community that's bringing it into these facilities. It's not the facility's fault that they're dealing with what they're dealing with.
Grant County Health District officials have confirmed that at least 3 wedding guests went to work at a long-term care facility in Moses Lake while infected with COVID-19, but they didn't know they were contagious. 15 people died in that outbreak at Lake Ridge Center in Moses Lake, with 3 more deaths awaiting review. These deaths happened after the wedding, but the health district says it can't directly link the deaths to the infected workers. Those health officials also say they suspect staff at another long-term care facility in Grant County, Columbia Crest Center, may have attended the wedding, but employees who tested positive for COVID-19 there didn't confirm they were at the wedding. 8 people have died in the outbreak at Columbia Crest. Grant County health officials did confirm at least 1 long-term care facility resident died as a result of the wedding. That death happened at a facility in Ephrata. There is at least 1 more outbreak at a Grant County facility. McKay Healthcare and Rehabilitation suffered an outbreak earlier this year, but it started before the wedding was held. McKay says it isn't managing any active cases at this time. Now, we should note that the Moses Lake School District reported that 11 staff members said they attended the wedding. That caused it to spread to at least 1 other staff member. The district also reports 14 additional cases that could be tied to the wedding, but that has not been confirmed yet. So far in Grant County, 65 people have died of coronavirus, with a little more than a third of those being residents in long-term care facilities. Joshua?